is IVF process and how long does it take?
IVF is in vitro fertilization. Fertilization generally, but what is fertilization? Fertilization is there is egg formed inside female and sperm formed inside male. When they fertilized inside the body, fertilizing means joining together and making a microscopic body, baby. So that is called fertilization. Generally, it happens inside the body in the fallopian tubes of a female. But when it is done in lab, then it is called in vitro fertilization. Embryology lab, when we make a baby and transfer it back to the uterus of the female whose womb we are supposed to, who's the expecting mother. Then we transfer.
Okay. And how long does the IVF procedure takes?
The procedure per se takes 2 to 3 weeks, starting from the day 2, day 3 of the female's menstrual period. It's 2 to 3 weeks.
All right. Okay. So, how do you determine that a patient requires IVF or not?
Most importantly, IVF is not the first treatment of infertility. First of all, we need to know that the patient is infertile. When a couple comes to us with history of they are married for more than 1 year and they are not getting pregnant, the female is not, the lady is not getting pregnant, in spite of trying for 12 months, means 1 year, she is called infertile. There are multiple reasons of infertility. Like, yeah. Okay. So the very important thing is infertility can have many reasons. The problem can be in a male or the male partner, or it can be in the female. And in male and female, there are multiple reasons why infertility is there. There are important organs involved, which is the reproductive organs. In female, it is uterus and ovary and fallopian tubes. And in male factor, it is the most important test we do is semen analysis. We assess the parameters, which what all is the sperm parameters are good or not. That is amount of sperm in the seminal. That is how they perform, how they, the motility we call it, how much percentage of the sperm is healthy. All these things are seen. So the major factors which leads to infertility, which needs IVF, is the tubal factor. When the tubes of a female is blocked, we do IVF. When there is some problem in the ovary of the female, like either she has severe PCOD, might PCOS or PCOD does not need IVF. If there is very poor ovarian reserve, means that number of eggs in the ovary is very less, or the quality of the egg is not that great, then IVF is done. If you have endometriosis is a disease, if you have that problem, if there is severe factor in male sperm is very less, or the normal number of sperm is very less, or the motility is very bad, there is a severely affected sperm quality, then these are the reasons. There are multiple other reasons to IVF. These are one of the very common reasons.
Got it. Okay, so what I have heard is that when a person goes through the IVF procedure, they undergo various psychological and emotional challenges.
Yes.
So how do you deal with that?
All the IVF centers are supposed to be equipped with psychologists. So it's a multidisciplinary approach. We have psychologists with us, we have psychiatrists with us, we have dietitian with us, urologist with us. So it is a multi-centric approach. So we have a separate psychologist for counseling of the infertile patients.
Okay, all right. So again, another thing which I have heard is that IVF is a costly affair. Is it true?
Costly affair? What do you call costly?
See,
as I said, that it is in vitro fertilization. Can you imagine something happening inside the body at a specific temperature, in the specific environment, in specific acidic, whatever pH, that the same environment you need to create inside a lab. Creating that environment costs you a lot. You need special instruments, you need special labs, you need highly trained individuals who are called embryologists. So this is one factor which increases the cost. The second factor is that generally in a female's body, one egg is produced per cycle. But in IVF, we try to get more and more number of eggs. More and more number of eggs. That is the reason we are supposed to give multiple injections, to 10 to 12 days of injections. These injections are very specific because they are targeting more than one eggs at one time. So these are very specific injections, and they are, yes, they are expensive. But the cost of IVF has decreased a lot as advanced through years. It's 40 years now. 2 days back there was World IVF Day. It is on 25th of July, and we planned to do this session that day, but somehow we are here on 20. So the cost of IVF has decreased a lot. When it was started almost more than 20 years back in India, and now it is a whole lot of difference. And if you compare the price of tomato,
That is true. That is so true.
it's not
All right. Okay. So even the multidisciplinary team, like you just spoke about, that also, somehow adds up to the expenses. Like since there are multiple doctors involved, I can't hear you.
That is required. It adds up
Yeah.
because male infertility, there are specific things which are done only by urologists, and now the newer guidelines have the ART world, or we call it artificial reproductive technology, has changed after a new bill, ART bill has come, and they have tried to do it better and more specialized, so that is the reason. It will be a little expensive than earlier, but yes, that is the right approach.
All right. Okay. So along with this, like as of now, the IVF centers have mushroomed all over in every city. So how can a person decide which is the right center, and what things should be kept in the mind while choosing an IVF center?
See, very important thing is the lab should be accredited. It is not very easy to find out. It is not. You can see the social media and the Google marketing has made it a little easier, I would say. Rather, sometimes it's misleading, but yes, the easiest way out is you generally don't end up directly to an IVF center. You go to a general gynecologist, you go to a gynecologist most of the time, and as I said, that all infertility patients, they don't need IVF. So the best way is go to your gynecologist, talk to them. If when they advise you IVF, then visit an IVF specialist. And it's always better because you might not be knowing, Google might not be knowing sometimes who's the best. But yes, your gynecologist will be knowing who is the best IVF. Not best, everybody is good, because there is a lot of training involved, lot of experience involved. So it's best that you go by your doctor's advice.
Okay. And you just spoke about an accreditation.
Basically, gynecologists, they'll be knowing each other.
Okay, all right. Okay. So you just spoke about an accreditation. Which accreditation are we talking about? Is there any specific one?
There are multiple accreditation, like all the IVF labs are recognized by ICMR.
Okay, all right.
Indian Council of Medical Research, and you can't practice without their certification. So that is, and some of the very good IVF centers have NABH accreditation also.
Okay.
But there are few. So please please don't look for that in smaller towns. You might not get it. So ICMR is good, and the best judge will be your gynecologist or your go-to, not even gynecologist. If you go to your family physician, anyone, so she or he will be the best person to tell you where to go for IVF.
Okay, all right. Okay, so when a child is conceived through IVF, is the child different in any form from a naturally conceived child?
Yes, the child can be different, but they might have better IQ and better. The child we have seen, and the studies now say, are smarter than the normally delivered, the normally conceived child. Why? It is nothing different. The thing is, because these children are very precious. They have gone to a family which was wanting this child since years. So they are well kept, they are well nourished. उनकी upbringing ज़्यादा अच्छी होती है. Parents are more baby centric. So the research says कि बुरा कुछ नहीं होता है. They might be better than the average class.
Okay, all right. So, except the parvarish we are talking about.
Kids in the family.
I'm sorry, Dr. Nidhi, I couldn't hear you. Go again, please.
They are the highly wanted kids in the family.
Yeah, that is true.
Earned a lot of efforts. So they are highly privileged, and parents have been taking very good care of them, and nothing genetic, nothing different, just they are well kept, so they are well performed.
Okay. So while a mother is undergoing IVF, are there any lifestyle changes or preparations that you would recommend to optimize the IVF success?
Yes, this is a very important question. First of all, you should improve your lifestyle. It's not only for IVF. Whatever I'll say will be about everything. Whenever you want to conceive, it's naturally or IUI or IVF. First of all, obesity. It is a pandemic. So please improve your lifestyle. Smoking, drinking, these things you should omit. The weight loss is you should have a good lifestyle, improve your dietary patterns, improve your dietary patterns, improve your exercise. We don't advise very aggressive exercise during the IVF cycle, but before that, you should be doing exercise so that you control. So, and I always advise, see, this is a couple treatment. Any infertility treatment is a couple treatment. It's always better that you sit and decide that, yes, both of you want a child. That is also very important. So both, as a couple, you want a child. So mental balance, physical fitness, nutritional deficiency if you have, very important, plan for a baby. There are some screening tests, viral markers we call it. Should be hepatitis, HIV, syphilis. There are a few diseases you should be screened for. Even if you are not planning for child right now, there are couples, they are recently married, but they are not very young, like in late 30s or even early 30s. Even if you don't want a child, please visit a gynecologist so that they will at least assess you, that whenever you are fit to bear a child, or you have good ovarian reserve or everything else, at least they'll examine you once and tell you that yes, you can wait for 1 or 2 years.
Okay, all right. So one of our viewers has asked a question on this note only. Can stress impact the success of IVF treatment?
Can stress? Yes. Stress is a very, very, very important factor. Not only IVF, any of the diseases, stress affects. You can have hypertension, not only stress, but yes, with everything else, stress also affects. You can have diabetes because of stress. You can have hypertension because of stress. You not exactly have infertility because of stress, but yes, any kind, whenever you go for infertility treatment, we always, not always counselors, we also act as counselor. any of your close by doctor, your family acts as counselor. So yes, stress level, and I specifically always say